Hello everyone, I'm Claudia Owes from Mid Architect. So today we are going to learn about external oblique muscles. So we'll see what this external oblique muscles are. So if we talk about the general anatomy of the external oblique muscle, this is the most superficial flat muscle of the anterior lateral abdominal wall. So this is in front as well as lateral. So this is the largest and most superficial out of the three muscles that form the anterior lateral abdominal wall. So it lies over the internal oblique and transverse abdominicus, completing the outermost muscular layer. Morphologically, the external oblique is considered the thoracic equivalent of the external intercostal muscles. Its fiber orientation, running inferior medially, that means hands in pocket positions, resembles external intercostal between the ribs. This muscle is broad and flat, arising from the lower thoracic cage, spreading across the lateral and anterior abdominal wall. Together with the internal oblique and transverse abdominis, it forms a layered muscular envelope that supports and protects the abdominal viscera, maintains the posture, contributes to the movement, and intra-abdominal pressure. So we'll see its origin. So this external oblique originates via eight muscular digitations from the outer surfaces of the lower eight sheets. So basically it is the lateral part but of the anterior extremities. So the upper slips interdigitate with the serratus anterior, while lower slips interdigitate with the latissimus dorsi. So fibers run inferior medially like hands in pocket. So posterior fleshy fibers insert into the anterior half of the outer lip of the iliac crest. Anterior fibers form a broad, flat aponeurosis directed obliquely downward and medially. Aponeurosis inserts into the linea alba, interlacing with the fibers from the opposite side. So lower border of the aponeurosis form the inguinal ligament. So inguinal ligament is formed by thickened, folded, and under the lower border of the external oblique aponeurosis. It stretches from the anterior superior iliac spine to the pubic tubercle, forming the floor of the inguinal canal. And superficial inguinal ray is a triangular gap in the external oblique aponeurosis situated just above and lateral to the pubic tubercle. Above and lateral, it serves as the external opening of the inguinal canal, transmitting the spermatic cord in males and round ligament in females. Lumbar triangles of Peyket, a potential weak area in the posterior lateral abdominal wall. The posterior border of the external oblique forms its anterior boundary, while latissimus dorsi forms the posterior boundary, and iliac crest forms the inferior base. So this is a site for lumbar hernias. Rectus sheath. The external oblique aponeurosis contributes to the anterior layer of the rectus sheath throughout this entire length. Above the costal margin, it is the sole and anterior covering of the rectal abdomen, encasing and protecting the muscle and its neurovascular supply. So if we talk about the nerve supply, it is innervated by the anterior rami of the lower six thoracic spinal nerve, T7 to T11, and the subcostal nerve, that means T12. If we talk about the actions, we can see flexation of the vertebral column, lateral flexation of the trunk rotation. So here you can see how lateral flexation occurs. And lateral rotation occurs. And trunk flexation. These are the actions. So surgically, uh, thoracotomy. For thoracotomies, we use this as a marker. And also, McBurney's incision is the classic approach for the open appendicectomy. When we get appendicitis, we use McBurney's incision. The external oblique aponeurosis is sliced along the direction of its fibers at McBurney's point, one third of the way from the anterior superior iliac spine to the umbilicus. The underlying internal oblique and transverse abdominis are split along the fibers, providing access to peritoneum with the minimum muscle damage and reduced risk of hernia formation. Thoracotomy. In thoracotomy approaches involving the lower ribs, the external oblique may be incised to gain adequate access. The muscle fibers are inferior medially, and incisions parallel to these fibers minimize the denervation and functional loss. Recognizing the fiber orientation prevents uh, damage to the intercostal nerves. So, as for the summary, this is the most superficial fly. Origin is from the 8 digitations. There are 8 digitations from the lateral part of the anterior extremities. Insertion is to the iliac crest, posterior outer lip and linea alba via broad aponeurosis. So there are inguinal ligament, superficial ring and lumbar triangle. Nerve supply is from the anterior rami T7 to T12. That's it. Thank you so much.